So my whole job is focused on mental health response. And with that, things are changing. And I hear a lot in different meetings that the community wants to see something other than a uniform responding to these mental health calls. And personally, I've been to those calls where I really don't need to be there, and mobile crisis could have handled it probably themselves.
So my passion, my mission, my purpose is to eliminate health disparities. And we do that by going upstream. We do that by going into the community and defining with the community what health equity means to them. I'm excited about this program because it does just that.
I think this is going to be a game changer for the City of Des Moines. We have seen a lot of unique crisis responses being implemented in a lot of different bigger cities, but a city of our size, there's not a lot of programs this ambitious.
So the 911 dispatch center, otherwise known as the CARE program, is modeled after Austin, Texas. So back in July, we had a number of key stakeholders here in Polk County, City of Des Moines, Broadlawns, take a visit to Austin, Texas, and look at the model that they're implementing in terms of a 911 diversion program. So we're very excited about that.
It is under the same umbrella. We're working with Broadlawns. We're partnering with them to provide crisis services in our community. And one of the awesome things about CARE is it can offer complete diversion, meaning there might not need to be a field response. Somebody might not have to go to a call. And the reason how we're going to accomplish that is we're going to put a mental health professional embedded in our dispatch to help screen those calls to determine what is the appropriate level of response that we need. And then they're going to go through their own process of asking questions to assure safety, determine all those risks, but also decide what does this person really need. And so it's just a really unique way of using resources just in-house and having that expertise that we can't expect our dispatchers to have, that's going to really change things for the better.
Health conditions are not improved by our citizens just inside these walls. We need to go out in the community, meet many of our citizens where they're at, and making sure, and not just wait for them to come in the hospital. So this is just another example of that. So I just think it's a very exciting time to be at Broadlawns, and we want to be responsive to community needs.
First, I want to say that the patient is our North Star. Everything that we do and all of our efforts must be concerned with what's best for the patient. I hope that the CARE program helps to uplift and improve the mental health status of the residents of Polk County. I'd like the residents to know that Broadlawns is here for them, and we're here to serve their needs at every step of the continuum.
So the city's commitment to both the mobile crisis unit and the additional clinician in the 911 dispatch comes from the city's sales tax. And that was the community coming to us, especially the group Amos, who made it clear that they wanted to see additional resources for mental health services.
We benefit by having a clinical professional embedded in the dispatch. We can handle some of these issues when they're just kind of emergent or more of an issue, as opposed to, again, becoming a crisis or rising to the level, quite frankly, where it may be too late to save the individual. So there's a huge benefit to us going, quote unquote, upstream and identifying and addressing these mental health needs before they become a crisis.
Sometimes it's that nonverbal feedback, just that relief. I think that we're going to see a lot of families really excited to be able to use these services and know that a police officer is not going to have to show up for something very minimal that's going on at their house.